Hi friends, today we are doing the bone demonstration of the distal femur resection. So this is the ruler we are using for the resection of the distal part of the femur. So this ruler should be placed at the level of knee joint, just above at the level of the tibia. So the distal part of the ruler should be at the level of tibia. Then if you are planning the minimal resection length we should be always in taking from the distal femur is 7.5. So consider it as if it is a tumor of 5.5, we should take the minimal length of 7.5. Always get a margin of minimum of 2 centimeters. So if it is 7.5, then we should take a 8.5 and 9.5. So here we are marking the 7.5. For the live demonstration, we are marking it as 7.5. Now, on the anterior view, place the ruler at the mark the center of the femoral condyle and also at the center of the shaft of the tibia. It should be placed or marked. Otherwise, during the cutting of the distal femur, there will be some problems, and make a mark at cruciate. And we are doing the cutting now. With a bone saw, cut the distal part of the femur. As far as possible, the cut should be perpendicular at the level of the cruciate marking. Now we have resected the distal part of the femur and reflect back. Now the thing is that we have to take a biopsy from the distal part of the femur and send for the frozen section. And if the frozen section and the pathology should be ready, and if it is clear, then proceed with the further surgery. Now the serial reaming of the femur is done. Usually we will start with size 8, and the serial reaming should be done. The thing is that only after getting the frozen section we have to start reaming. Otherwise, if there is no adequate margin, then the tumor will move upward. That there will be infiltrations. So be careful. It is known as face reaming. The thing is that we have to fit the prosthesis correctly at the distal part of the femur. So we are doing a face reaming at the distal part of the femur. So face reaming is done for the correct fitting of the prosthesis with the femur. We can see here this marking. There will be marking on the prosthesis also. That should be corresponding with the marking we have done initially. So this is the trial prosthesis we have put at the distal part of the femur. Now we are doing the tibial cut. We are doing an external jig for the femoral tibial cut, and the pin should be placed at the anterior part of the tibial spine, just anterior to the insertion of the anterior cruciate ligament. And with a stylus, look for the cutting before we doing a cut with the bone saw. Usually it is 2 mm at the middle side and 8 mm at the lateral side. We have to put the pin at the mark of 0. And if there is after cutting, we can change accordingly. But usually, similar to TKR, we will be putting the pin at 0. Place a oblique pin also for the stabilization of the jig. So now we are placing the oblique pin. Now we are going for a tibial cut. So cut as far as perpendicular to the bone, and always check the aftercut of the tibia, similar to TKR. Proceed with the cutting. And always use a angel wing to look for the amount of resection we have done, or is there any bump or the abnormal prominence of the bone. Now we are removing the pin from the tibial jig. The thing is that we have to mark the tibial tuberosity, and before placing the sizer of the tibia, we have to mark that is medial 1/3 and lateral 2/3. That usually it will be the center of the tibia. Now do the serial reaming of the tibia. Usually starts with the size 8. Since it is a bone model, it is somewhat difficult, but it's usually on the live surgery it will be somewhat easy also. Now do the serial reaming. Usually we will start with the size 8 and continue up to size 11. Try to maintain the alignment with the shaft of the tibia. You have to reach the medullary canal of the tibia. Now we are doing the tibial preparation. Usually it is known as the proximal tibial preparation with a keel punch, and we will the keel punch or the tibial preparation. Before doing that, we have to measure the size of the tibia. It is similar to TKR. It is usually starts with the size 3. So take appropriate size. From size 3, we have to place the jig and make the appropriate sizing. So now we are already placed a size 3 tibial implant. Try to insert it, and we are doing a punch to insert the trial tibial implant. So here in the demonstration we have used a size 3 femur and also size 3 tibia. So this is the trial implant. We have put a insert. This is an insert. This is the rotating platform. We have put a rotating platform. And this is known as the axial. This is for the stabilization of the rotating platform with the femur. And we will be also putting a screw on the medial side of the axial. While doing the surgery, always check for the flexion and extension, and also the valgus and varus, and also the medial and lateral translation. Now this is the implant used for if there is a tumor on the proximal part of the tibia. And most of the steps of the surgery is similar to the distal femoral cut, but the thing is that there is holes for the implant. There is holes for the implant for the suturing of the pes anseri and also the tendons around the knee joint. That is one thing. And we have to resuture the pes anseri and also the tendons around the knee joint to the proximal part of the tibia. And thing is that this is a ruler similar to the femur, and we have to mark at the minimal resection of the 7.5. And after that only you have to proceed the cutting. So thank you for watching.